I'm Sue and I'm a cancer survivor. Hey Jim, come on. Jim, come on girl, come on. Good girl, come on, good girl. I was diagnosed with HER2 positive breast cancer in 2007. The HER2 positive means that the cell was more likely to grow fast and spread more quickly, so it makes it a slightly more dangerous type of breast cancer to have. I discovered that I would need a drug used to counter the HER2 positive type of breast cancer. I discussed it first with my husband, and he just said straight up, "We'll find the money, don't worry, we'll do it." And we were fortunate. We were both earning okay, and we made a lot of concessions, and we shrunk our spending down, and so we paid for it ourselves. If I'm going to cope with something, I need to understand what it's about. So I expect my doctor to give me the information, answer my questions. I know that they don't know everything. I know there'll be some answers they can't give, but I want them to be honest about it. I think that's the way most patients, all patients, are deep down. Some of them may not be able to articulate that, may feel they can't ask the questions, but I think that's important to be able to. Maybe again take someone with you, help you make those questions, help you make sense of the information. When you're going through something like cancer, you need a lot of support. And the support, first of all, came from my family and friends. And then I really did need to look a little bit further than that. And the Cancer Society was one place that I discovered. You could drop in and just have a chat. They had at that time a breast cancer support group, and following, I didn't go there immediately, but some months later I decided to go, and I've met some really lovely people, and it was amazing just to be able to talk and have them understand what you're going through. You didn't really have to explain much. They're just nice just to have an ear. I talk with a lot of people who have cancer because I facilitate a cancer survivorship group now. And one of the things that we talk about in those sessions is the importance of having an advocate for you when you go through your treatment. And a lot of people don't realise that a general practitioner is actually an ideal advocate for you. They can help clear the way of a lot of those issues that you perhaps as a person, one person or your family member can't. They can ring up the specialist, for example, and get an answer just like that. So use your GP as an advocate. It's really an important role. So what has this experience taught me? My husband and I, we live a much simpler life these days, but actually I think it's a happier life. Having had breast cancer, I've gone through feeling like I'm going to be the one that's going to die early, not see my grandchildren, to realise that actually most breast cancer patients survive breast cancer. There are so many new treatments coming online. Not all of them are funded. Not all of them are going to be funded. And sometimes you have to bite the bullet and dig deep and ask for some money, or fundraise for some money to help fund your treatment. But there's people all the way along the line there to answer your questions, to hold your hand, to keep you motivated, strong, and friends and family, the love that you get from them. It ends up with cancer often being quite a positive experience in the end, and that's perhaps surprising. but it's true.